Well, good morning, everyone. Thank you very much for coming. My name is Mike Black. I am a managing director at Deloitte. I'm responsible for all of our technology strategy in healthcare, as well as all of our cloud offerings within healthcare as well. Today with me, I have Sahiti Bayana, who is one of our leaders in healthcare cloud, and Dan Bennett, who is the chief technology officer at Geisinger. And what we're going to talk to you today is about Geisinger's full-scale transformation enabled by cloud through a self-funding mechanism. But before we do that, I want to talk to you a little bit of what we have seen in the industry from how cloud can help change health, and specifically some of the challenges that we've seen encountered through in healthcare. Specifically, again, there's a lot of rising medical expenditures. There's increased costs in IT and the business. There's workforce challenges. The Great Resignation has affected healthcare more so than many industries, specifically around the ability to attract and retain talent. And the effects of COVID have exacerbated a lot of these. But one of the most important elements and challenges that we've seen is around data. The fact that data is in silos in healthcare organizations, and we have not been able to unlock that with traditional means of working. There are many opportunities to leverage that data that's out there in healthcare to change the outcomes for patients. From a future of health perspective, if you think about how we can use cloud to change how the future of health is architected, the first element is around an omni-channel digital experience. Pardon me. Using cloud, the clients are now looking for that. That is what the experience they want to have. And the other, like I mentioned, is around data. Using data to improve those outcomes, specifically around, lost my train of thought. Using data to improve the way that we get insights from organizations. The cure for cancer is out there. The cure for many diseases is out there. We have not been able to unlock it yet. So today what we're going to talk to you a little bit about is how we utilize, utilize a self-funding mechanism. To transform healthcare. So Dan, I'll pass it to you to talk a little bit about Geisinger.
All right, sounds good. Thanks, Mike. So I come from Geisinger Health. We're in Pennsylvania. And we are a 13-hospital, 13-campus healthcare organization. We're an integrated healthcare system, so we also have an insurance plan. We've recently broke about 600,000 members in that insurance plan. We've expanded our Medicare and Medicaid a lot in the last year, so the number we have up here has actually expanded in the last month or two. We have about 3,200 providers and tens of thousands of other ones that we contract with, things like that. We also have an academic medical school, School of Nursing, nursing traveler program that we established. So we've got a lot of each of those different facets that any individual healthcare organization or some of the other integrated healthcare organizations. So there's a lot of opportunity for us to use technology and align these different branches and these different things to provide a better patient experience, better health outcomes, all of those kind of things. So again, like I said, we have a College of Medicine. It's not just MDs, but we also do like informatics and other medical business degrees, things like that. And we acquired that a couple years ago, and that has allowed us to also be able to bring some of Geisinger's innovation right to the classroom, that as they come in and they do their residencies and they do other things, right, they're kind of on the front lines and bleeding edge of some of this technology. So, Mike mentioned COVID, right? We've spent the last 2.5 years coming and going through it and coming out of it. And, at the end of the day, healthcare as a whole, there's been some different approaches that organizations have taken to try to get through it, right? Reduce costs, cut your way out, some invest, other things like that. What Geisinger did is what we've branded as Geisinger Transformation. It's about 40 or so initiatives in the organization that we have funded at the executive level down using many partners such as Deloitte, right, in order to deliver and innovate our way out of COVID, right? Innovate our way out of, skyrocketing supply chain costs while having, payments stay where they are, right? So, one of the interesting things, and we talked about it in the provider panel, is, at the end of the day, when supply chain costs go up in most industries, such as a restaurant, right, the menu price change. It doesn't work like that in healthcare. So we've doubled down on innovation. We've doubled down on, spending money and moving the needle forward to provide better, more innovative care, bring, stuff to the home and all of those other things. So at the end of the day, all of these projects, the one that we're talking about today accounts for one of those, and there's 3 projects in the initiative under our IT transformation. And it fits in to where Geisinger's trying to go. We want to be profitable, right? 4% operating margin so that we can continue to reinvest as a nonprofit healthcare system into our communities, our technologies, our buildings, all of those, right? We want to continue to prepare for the future. So, Geisinger's been, innovative in a lot of space for a long time. And, cloud and cloud native services and, transforming, IT operating models and other things that we're all going to talk about, right, is a way that we can stay at or ahead of the curve as, interoperability and all these other things come out that some organizations are struggling with, right? We want to be ahead of the curve on those kind of things. And, again, that's kind of from the IT lens, but, the other 39 or so transformations are clinical transformations, all kinds of things, patient access, all that stuff. So, and then overall, we've been a value-based healthcare organization for a long time. So we're always trying to figure out how to better serve the community, better serve the individuals holistically so that we can keep them healthier as a holistic patient. So talked a little bit about this, better care, right? We're in healthcare, insurance, all that good stuff. So at the end of the day, what we're always striving to do is provide better healthcare, the best healthcare we can, right? And then also, cost containment, right? So we need to deliver that high quality, innovative healthcare while also delivering it at a reasonable price point so that, we can hit that 4% operating margin. The adaptable business model is a big one for us. So especially, I'm sure everybody in the room, right, loves supply chain right now, right? And how long it takes to get anything delivered. Going to the cloud, doing things like that, it's actually, our timing was really good for our project where we're going because we're at the point now where, we need a server, we turn one on, right? I don't have to wait 8 months for one to show up or, networking gear, things like that. So adaptable business model, it's going to allow IT and Geisinger to be able to ebb and flow and move and dodge and be able to be a little bit more nimble from a technology and an innovation space. And with that said, I'm going to turn it back over to Mike, and he's going to talk a little bit about where our journey started and go from there.
Absolutely. Thank you, sir. So for Geisinger, what we did was we looked at it, as Dan mentioned, a holistic transformation. We started with an assessment of their infrastructure. We looked at their operating model, and we looked at their application environment. And again, we went through their applications, their infrastructure, even their data centers. Now, Geisinger I've built data centers over the last 20 years, built and run data centers over the last 20 years. They had some of the most impressive ones, and still do, some of the most impressive I've ever seen. They won awards for most wired. But they realized that they're not a data center company. So it was an opportunity to transform, to focus on patient outcomes. So what we did is we looked at all of we performed an assessment to look at benchmarking, which we'll talk about a little bit later. But we did this benchmarking to identify areas of optimization where we could cut costs out of the system before going to cloud, optimize before going to cloud, and taking a holistic view of it, not just looking at the servers to do a lift and shift only. So as a result of that, we also helped them do business capability mapping to make sure they had the right applications for the right functions in their organization. We helped put in governance structures. They're using cloud native security through AWS to help provide that incredibly strong, secure perimeter. Also, we help them with a more product-based operating model so they could be agile in the way that they work with the business. And then the last is around their cloud service delivery model, helping to ensure that they could meet the demands of the business through cloud. And then, so ultimately, that exercise yielded quantitative and qualitative impacts for them. On the quantitative side, we helped them consolidate their application portfolio from 1,500 applications down to the benchmark of 1,100. We helped also optimize their infrastructure footprint to reduce it by 40%. We were able to, they were approximately 10% in cloud when we first started this journey, and now they're going to be 90% plus in cloud, and helped optimize some of their staffing by about 12% to be a little bit more nimble and lean. And then the qualitative benefits, which I'm sure everyone is familiar with them, but they were also able to see, to leverage now data to provide true insights to the organization, helping to have actual data strategies and better security constructs in place. Also being able to, sorry. And then the last component was a digital front door, the ability which I talked about before, having that digital omni-channel experience, being able to leverage that. So how did we get there? What is the framework, that self-funded framework that we were talking about before? 80% of the clients that I advise, they say there's two big objections to going to cloud. The first one that I'll talk about is around the cost. That is, it's too expensive to get to cloud. So if you look on the left, this is your typical migration cost profile. You have the higher costs for implementation, and then you have duplicative costs that while you're running in cloud and you're running your existing infrastructure. And eventually you get to a break-even point, and then you start to optimize maybe once or twice as you're going through the process. What we really focused on doing is partnering with AWS and Geisinger to flatten that cost curve, and to move that line to the left. And the way that we did that, again, we looked holistically at their environment. We looked to optimize cost before going to cloud. So doing application rationalization and getting rid of the apps that they're not using. Looking at their infrastructure, overall infrastructure. What can we take out? What application debt can we take out? What tech debt can we take out? Any of the specialized skills that are associated with those applications that we remove. So you take an application out, you don't need the underlying infrastructure, and you might not need those specialized skills. So again, removing those costs, optimizing those costs as much as possible so you don't take them over to cloud. Then we also partnered with AWS, and they were able to provide incentives and credits to help minimize that cost. And then we used all of those cost savings to create a business case for their executive leadership to show that we can use all those savings that we identified to fund the migration to cloud. So as we progress through, and then the other piece is once we got to that break-even point sooner, then optimize, continually optimize. Look at where you don't need infrastructure online, off hours, for example. Optimize where you might not need peak loads. Make sure you're using dynamic resource scaling to ensure that you are getting the compute that you need exactly for that moment. So now, as we look at what that framework was, what was the framework that we used in Deloitte? So this was, again, very early on, we used Deloitte's cost optimization framework. And it's broken into three areas: IT operations, applications and data, and then infrastructure and security. And we did benchmarking to Geisinger's peers and said, where are there meaningful cost savings that we can take out, again, before going to cloud? And really where, for Geisinger, the ones that are lit up, this is where Geisinger found the most savings. Again, bucketed into those three areas. And if you remember what I said before about it's not just about lifting and shifting to cloud, it's about a holistic view. Because if you just look to lift and shift, it will cost you more. It'll cost you 25 to 35% more. It will not be cost effective to go to cloud. This is why you need to optimize your environments, optimize your infrastructure, and take a holistic transformation view to it. So for Geisinger, the way that it worked very well for Geisinger, and where a lot of health systems are starting to really embrace this strategy. So I talked before about cost being one of the biggest challenges to getting to cloud. The second is alignment. We have a number of CIOs that will tell us, yeah, we want to go. The CIO at Geisinger is like, I'm ready. I want to be cloud first. I want to go 100% in. but my leadership doesn't even know what a hyperscaler is, or they don't see that there's any value. You already have data centers, why do you need cloud? So the way that we did this was we helped first build a cloud strategy and vision and developed a business case where we looked at those three levels, the IT operations, the applications, and the infrastructure. We built that business case, a top-down business case first, to show what the business case could look like, and then we stopped very intentionally, because then we took that, it was a quick sprint, 8 weeks, we took that, and then we helped socialize that and educate the leadership and the board. And once everyone was in alignment, they're like, okay, let's go to the next phase. The next phase is a detailed ground-up build of that business case, GL line level, looking at the applications cost, looking at the infrastructure costs, the people costs associated with it, identifying the rationalized applications that we can take out, because they're either A, they can be retired, B, they're not being used anymore, or C, there might be duplicative applications. That's where that business capability mapping comes in, what I talked about a little earlier, where you look for the functions that you need in the business and map the applications to it. For example, they might have organizations, another organization I work with, had 3 document management systems. They were all cloud suitable, but they didn't need 3. So basically we said, get those out of the system before going to cloud. Then once all of that's done, we stopped again. We validated that business case worked. We got alignment again with the leadership. And then we went on to the next phase, which was the actual migration factory, where we're just churning through the waves plans that we've done. We created waves based on the affinity of different applications being tied together, and then use that to drive the waves that we were going in phase 3. And 4 is about implementing that operating model that we talked about. Making sure that you have that product-based operating model, that you have a cloud service delivery model ready to go as these applications are going in. And then tune, optimize, making sure that that's just part of the regular governance going forward. So now what I'd like to do for the next couple of slides, Dan and Sahiti are going to talk to you about some of those breakouts, the operating model, the application rationalization activities, as well as the infrastructure and security. Then we'll wind down with some lessons that we learned as well. So now I'll pass it to Dan. Over to you.
Thanks, Mike. So, this was part of the phase 4 planning that we did, but ultimately for us and for anybody else, right, you can't change technology without changing the way that you operate, right, at the end of the day. So what's very unique about this slide, right, is we call it the technology operating model, but if you look at the color codes and all the things, right, out of all those boxes on the bottom, only 2 of them are technology-based, right? So we spent a lot of time focused on staff, skilling, and ultimately what does IT need to look like in this new world where, we were historically, as Mike said, right, we adopted a decent amount of SaaS, right? But we didn't have a lot of infrastructure as a service or any kind of major, cloud environment up until doing this. It was all project-based. So we had to think about how are we going to support on-prem data center and cloud, right? Hybrid architectures, things like that. What are the skills that our folks need as we move to the cloud, right? Because networking, server, storage, everything's completely different, right? The concepts are the same, right? It's all the same kind of, lingo and all that other stuff, but at the end of the day, how you control it, how you build it, how you manage it is completely different, right? One of the things early on, talking to our platform services teams, one of the biggest things that they need to start looking at and start thinking about is how are they going to get into a DevOps mindset, right? Because now you're going to code your servers, you're going to code your network, you're going to do that, you're going to want version control, right? You're going to want all those things that historically with the other technologies, you never had that kind of mindset for it. So we changed, skills, we tooled, we spent, money on Amazon training. And then, ultimately, we look at how we're structured prior, how we're structured now, and having discussions about what we need to look like here in the next, 12, 18 months to be successful, right? Deliver the most value, have the right people doing the right jobs at the right skills. One of the other things we did, and, this is where a lot of organizations struggle. We struggled there for years, right? How do you bridge that divide between IT and business, right? How do you have people that are heavily technical in nature, right, provide those business conversations and that business value, as well as the ones in the business understand why you're doing what you need to do. So We started up, kind of, restarted some of the things we've done in the past, but kicked it up a notch. We started what we call a tech partner program, where we have dedicated folks that have an IT and business background. So, and then we embed them in our different service lines. So, those leaders of those service lines have a dedicated person. That person's in charge of, knowing what those business segments need, where they're going. Then that collective group tries to find the synergies across the org so that we're not bringing in 2 or 3 of the same applications again, just because 3 or 4 different departments asked for similar things. So we've tried to really closely align the business and IT closer than we ever have before. And it's providing a lot of value because we're getting to know the business much more in depth. And then they're getting to see how the technology and the IT staff and the other things that have typically been behind the scenes or not thought about, how that's supporting their business operations and what their folks are doing. So with that said, overall, we're in the point now where it's implementation, right? We thought about the skills, the knowledge gaps, the staff, everything. And we're at the point now where we're in continuous improvement mode, right? So as we continue the journey, what are the skills we still need to get? Let's get that in the pipeline, right? It's a constant learning, moving needle of the skills that our staff are going to need because cloud and everything is so dynamic, right? Our staff needs to be dynamic as well. So I'm going to turn it over to Sahithi here to talk about our application rationalization and, how, Geisinger needed to get healthy from an application perspective prior to moving, because you don't want to move the stuff that you don't need anymore. So we did a little get healthy exercise and have decommissioned a bunch of good stuff.
Fantastic. Great. Hello, everyone. My name is Sahithi Bayana. I'm really excited to be here talking to you because this is one of my favorite things to talk about. So we just talked about, just as a quick recap, we're going to get healthy and then stay healthy. And as Dan had just shared, they've already paved the way to stay healthy by bringing that culture, bringing that operating model, and really embracing the culture around cloud. And prior to that, I think Mike had set up really good context around why this transformation was needed in the midst of COVID. Everybody within healthcare, including IT team, are essential workers, and yet they took on this really intense journey in order to not be at that point, continually evolving in a way to become that innovative, more focused to better care to their patients in the most optimal way possible. So essentially, that being a recap, our objective was to come in here and really help Geisinger become that innovative company. But the question remains, how? How do you want to start thinking through that innovation? So when I talk through application, think of it as what an application does to serve the business. So I'm going to talk about it in a triangular fashion. So think 3 things, right? So when you think of an application, it needs to map to a business capability. So the first thing we did was, through our journey, we said, okay, you have all these applications, and we understand a lot of people are using external users, internal users, a lot of moving parts integrated across the, your entire ecosystem. What are they actually trying to accomplish? Where do we need innovation? So we essentially did a capability to application mapping. And the goal here was to really understand what is it that you're trying to accomplish, and are there any gaps? If there is anything you want to accomplish on top of that. The second point to the triangle is to really, truly understand what lies beneath your applications. So there's your servers, networks, storage, all kinds of technology-minded folks trying to do very cool stuff to optimize it in a way that the application runs as fast as it can so that it serves whoever the user is the best possible way. So from that perspective, we wanted to have a single pane of glass vision into what is the technology? If you're considering moving to cloud, and that's where you want to think through your transformation to be as innovative and agile as possible, what do you have today? Let's take a stock of that. And I know Dan will dive into that a little bit more, how we kind of went through that journey from a discovery perspective. But that's the second lens, right? Like, really understand your application from a bottom-up perspective so you know what that application entails. And then last but not least, all of this has to make sense financially, right? You can't just drain it. So this is where the self-funded model that Mike kind of touched upon from that honeycomb slide, how do your financials truly map to this application? So essentially really understanding how much each of the applications cost, so you're being very smart about how you're making decisions around these applications. If it's a $5 worth of application, are you going to spend about 3 months worth to decommission it? Or like, what is the right answer here, right? So for us to truly understand that, really digging to understand each application licensing costs and how that maps to your future state and what is a more strategic application. So that's the third lens. And this was definitely not an easy journey. Just like any other organization, tracking per application costs was not the most easiest journey we've taken, but we came out of it with a way so that we can estimate, hey, this is a small application, medium application, large application, wherever there's missing data, for us to kind of fill in the blanks so that we keep marching forward where there might be gaps instead of falling into an analysis paralysis state of mind, right? So that's essentially the three-legged stool, or the triangle, if you will, where we started our journey. With that said, I'm not going to drain the slide, but essentially to help you is the box where, we want it to be. What is it that, AppRat is supposed to get to you? And we'll dive into the results a little later into our discussion. So with that said, this is sort of where Deloitte brought the best of our framework to kind of help map into that app rationalization or application lens transformation. So you'll see to the left of the slide, there's a 2x2 matrix, and if you're familiar with AppRat or have dabbled into it, it's the standard Gartner 2x2, where you're essentially repurchasing, you're maintaining, you're retiring, or building. What you'll see is two of them are grayed out. And now from a cloud lens perspective, what do you do with applications that you want to just keep, or you just want to kind of upgrade, or whatever the right answer there is for you? What do you want to do with them? The answer is actually this is how you consider this list of applications to move to cloud. One thing that we partnered with Geisinger the best way, I think, is where we said, we're not going to take any of your trash into cloud. We're going to get rid of it ahead of time. We're going to optimize the processes ahead of time before you actually consider moving to cloud. And the way we did that is essentially look through your entire application, those two boxes in blue. Where can you retire an application? And we'll look at the results in the next slide, but where can you possibly eliminate an application or a technical debt or anything ahead of time before you consider moving to cloud? And that was a really exciting journey because there's varying opinions on what is the right point for you to stop optimizing or getting rid of something. And if there are 3 or more applications doing the same thing, what is the right answer for you to move to cloud? So there were a lot of hard discussions and very difficult questions that were answered through this. So having that culture embracing this entire journey, as we moved from this initial discussion of what is an application versus a tool, all the way to these are the list of applications that are truly strategic for Geisinger to be moved and transformed into cloud, was a very interesting way for us to have evolved and thought through and come across it. With that, I do want to give a quick stat. I think there were about 200 application owners that were involved, every single one of them actively involved, making decisions about their applications. Over 350 folks show up to our town halls or kickoff meetings with very interested mindset. So when we talk about culture, this is not something an executive did in a silo so that the rest of the organization followed. It's the entire organization embracing and making decisions for themselves so that the business comes out as innovative as possible at the end of the day. So that's the left-hand side. Onto the right-hand side, I'm going to quickly talk about cloud. When we first started the application categorization journey, Geisinger was brand new. I mean, they were in the midst of battling COVID, and they were in the midst of this cost-cutting transformation opportunities that Dan was talking about, nearly 40 of them. There was a lot going on within their organization, and we were using the word cloud transformation is the right way for you to think through innovation because that's where you want to be. And one of the best things I've seen Geisinger do, as well as they did, is ask questions. They said, first of all, give us Cloud 101 and how that's applicable to us. And they didn't stop. They said, don't do it to us. do it with us, which was incredible partnership from day one till today, where we've taken the journey with them. Every step along the way, every decision, every recommendation was a true partnership in nature. And this is important because cloud is not just about, hey, we'll get you there and be done with it. It's a journey where you take to understand it, really embrace it in the best way possible. And I say that because initially for Cloud 101, we did bring in, I don't know if most of you have ever heard On Cloud podcast, David Lithicum. So he came in and gave us about 3 sessions where he said, this is Cloud 101, as in what a rehost is, what a replatform is, what are the R's mean, what does cloud look like, why is this applicable to you, why should you actually look at your business case before you even consider cloud for your organization. All kinds of hard questions were asked, and only when comfortable, they said, all right, let's go forward with this business case journey. And that was really impressive, because if you don't ask the hard questions ahead of time, you can pull together the most amazing analysis, and it probably will not be used. So that's essentially the second part to it, where we've introduced this R categorization from a cloud migration perspective, and how that's applicable to Geisinger, and that results in your eventual cloud transformation journey. With that said, I'm going to quickly talk through the app rationalization analysis. We started with, you'll see on the top, about 1,868 applications, and ended up close to 1,000 applications. So all of those applications are definitely did not make the scope. And I just want to quickly talk through how this was a very intricate process, because when we were collecting data, we started analyzing for AppRat, but we also had to sort of parallelly think through, is this application also cloud compatible, without fully knowing how many of these applications might be in scope or out of scope. And this is really interesting to kind of, play both of these parallelly without having to do full exhaustive analysis. And essentially coming out of it, hey, here's essentially all the applications that are moving to cloud. And this is just a, categorization that's applicable to Geisinger, as we went through different ways of, okay, here's how our IT capability mapping is showing redundancies, or here's the applications that you probably want to consider SaaS for, or here's some of applications that probably have an overlap with your Epic functionality or Salesforce, and you probably don't need to take it to cloud. So this was a very, interestingly intimate journey for some of the application owners, because they've known that app for forever. They probably built some of those features, but were able to make those hard decisions to be able to come to this number. So with that said, I'm going to quickly advance to the next slide, and this is the other part to it, the cloud suitability analysis, where we said this application sort of falls very heavily. So Geisinger, just like majority of the healthcare organizations, is very COTS heavy. And you'll see that, that breakdown to your right bottom is essentially showing just that. And we talked through, hey, this is how your portfolio looks like. With that said, this is what a migration factory would mean to you in terms of how you want to consider your infrastructure prioritization, or how you'd want to kind of align what makes sense for you to move to cloud first. And all of that, actually, Dan is going to dive into it in a second, so I'll hand it off to him and then get back to you on the lessons learned.
Thank you. Mm-hmm. All right. Are you going to do this slide? No? Okay. All right. So when we talk about the key considerations for cloud optimization, right sizing is one of the big pieces here for us, and making sure that we get to the point where we're optimizing workloads, things like that. Our uptime and other, these are the different levers, right, that when you go to cloud, you can start pulling on to try to find your cost reductions, your efficiencies, things such as that. So the vendor discounts, things like that come into play. And then the pay-as-you-play kind of model, right, that you can spin things up, spin things down. Stuff like that all comes in to how we kind of went through the business case, looked at financial optimization, and other opportunities where some things may cost more, some may cost less, but ultimately, how do we get smarter with our our IT spend for the organization? Then the guiding principles overall for the group, right? These are kind of how we've aligned to our migration schedule, everything else, but when you look at, we classify our business capabilities, right? And then those then map to those applications that Sahithi was talking about. Then each application has an assigned criticality for the organization, right? Where We have to look at, how long can it be down? Can we live without it? All those wonderful things that a lot of people do when they're looking at disaster recovery and other things. And then those business criticalities, right, helped us prioritize various applications into the different migration waves. One of the other things, right, prod versus non-prod environments. Obviously, we started a monumental journey here, so we're not going to start with production systems, right? So the first couple waves were non-prod, test. So some of our systems would have 2, 3 environments, and we were able to move those prior to production to ensure that they're going to function properly, right? Latency, user experience. Some of them, we moved them. And, we realized that being in the cloud now, we might have to, put it inside of Citrix to deliver the experience versus before, when the data center was right there, you didn't need that kind of virtualization technology. So doing the non-prod migrations allowed us to test a lot of different things and prove out a lot of assumptions and a lot of theory to actually figure out what was going to work for us. Resourcing considerations, we've already talked about this, right? At the end of the day, do we have the right resources with the right skills to get us through the journey and then sustain the organization long term? And that's where we've doubled down a lot on our staff and, strategic partners and others to make sure that we're going to make it through to the end and sustain ourselves. Ultimately, the wave migrations, right? We broke them all up, different things, different orders. Again, with our different lines of business, each wave actually mixed different applications. There was some, provider ones and payer ones and, education ones all kind of mixed into the different waves. So again, it wasn't just testing the applications, but even the different lines of business and their type of applications and whether they were going to work out. So with that said, one of the big things around the optimization piece is that whole, wonderful idea that when I'm not using it, I don't have to pay for it, right? That kind of thing. So part of the analysis that was done early on our infrastructure yielded one of the most interesting things here, right, is out of all the servers that we, looked at and everything else, the majority of our servers sat there with no processing going on, basically, right, for long, long periods of time. But you have to account for the peaks, right? So, we're healthcare. A lot of the stuff goes on during the day, but we're 24/7 shop. So what this allowed us to do was kind of get that gut feeling of if we were able to spin things down. And we'll talk a little bit about EHR here in a minute. But, the idea that, I don't need that entire, hundreds and thousands of Citrix servers at 1 o'clock in the morning, right? So that's where we can take this, get a good idea of, what is our optimization window? What do we think we're going to be able to do long term instead of, procuring traditional hardware that's going to sit in the data center for, 16 hours a day doing very little, and at the end of the day consuming compute, air conditioning, all that other wonderful stuff. And then again, the memory utilization allowed us to kind of get an idea of ultimately, we spent a lot of money on memory, but how much of it are we actually using and what's the peak consumption? Again, heavily, virtual kind of stuff. So, that then also this was allowed to feed into a model to basically help with that business case that Mike talked about where we think our percentage of optimization is going to come from, after we get through, the initial journey, and then we can go back and start looking at these applications and starting to fine-tune everything. There we go. So this is the big one. It's a single slide, but we could talk like hours about this. So at the end of the day, one of the, we have a couple key systems, right, as a healthcare organization. We have our claim system, we've got our EHR, we've got our, LMS and education systems and all that stuff, right? But this is a huge one for us. So like I mentioned, right, we have a huge investment to run our EHR. We've got 2 environments that are identical to each other, identical hardware, and that's how it's built out. Then we have multiple environments under it with all of its own hardware and everything else. So the idea is, it's not consumed all hours of the day equally, but yet we have all that stuff running, right? We don't need to. And at the end of the day, that's one of the things that we're going to prove out through this is how can we auto-scale and do things, to spin stuff up, spin stuff down. And then the other big thing is the whole disaster recovery perspective of our EHR, right? They're identical, we can fail between them, we patch one, do all those wonderful things. But at the end of the day, the one sits there for a long period of time not being used, right? But it's identical in case we need it. So what we're going to do is we're going to build that identical environment, 2 separate regions, and then we're going to turn off everything that we possibly can on that DR environment and leave it there until it's needed, and then spin the stuff up that we need, right? So that's one of the things that a cloud platform is going to provide to us, so that we don't have all that hardware and all that depreciation and all those capital assets sitting in data centers that aren't really being used and they're just costing us money. The other thing, as we mentioned, the geo redundancy. We have 2 data centers. 2 primary ones, and at the end of the day, what this is going to allow us to do is, expand that divide between the data centers, get out of different weather patterns, all that wonderful stuff that everybody wants to do for your redundancy, and provide us to have different regions, different availability zones, and all that other interesting things. Okay, Citrix in the upper right, again, anybody that runs an EHR, especially the one that we do, right? It's heavy Citrix. So we feel that there's a really big opportunity there to have some savings from the amount of infrastructure we need to run throughout the day. And then you can see some of the potentials, right? This is what we're shooting for at the end of the day. So we've moved some of our environments already. There's many different environments, and some of our lowest level ones have been moved at this point, and we're on a journey here to move it all. So it's been really good so far, and if successful and we meet all the measures and all of the things that we put in here, these are some of the results that we as an organization expect to see. So one of the other things that comes out is cyber risk security, right? There's this notion that the cloud is insecure, right? Or it's going to create all kinds of other threats and things that you don't experience in your traditional data center, even though you host systems that are externally exposed and all that wonderful stuff. So one of the things that we do, and we spend a lot of time and effort on, as many of you do, is cybersecurity as a whole, right? We have a risk management department. We do all of those things, HIPAA risk assessments, all those. But we have a very, I would say, expansive cybersecurity program where security in depth, all those great things. But when we got to the cloud, right, it wasn't that the cloud is less or more secure. It's we have to protect it, but protecting it may look a little different, right? Again, it's the same principles. It doesn't matter whether it's cloud or on-prem. At the end of the day, there's the threats may look a little different. There may be some other opportunities because cloud technology is a little different, but you still have to look at it and protect it and do your risk assessments and everything else. So, we take our current risk, we design out, one of the big things we did here, and we'll talk a little bit, is, we used our cloud migration as an opportunity to hit the reset button on some things, right? Imagine if you just started today and you got to redo your entire data center and how you did it, and how you ran IT, and how you designed it, and all that. That's what this afforded us, right? A greenfield. So we were able to look at every layer and every angle and architect security by design, in design, right, for the organization up front. So it was done collectively and collaboratively between our IT organization and our cybersecurity function. So I'm not going to read all the little squares, but at the end of the day, these are many of the Amazon services that we leverage, right, as part of our journey. But what's interesting with this is, Amazon has a lot of great stuff, but not all of it when you're running a hybrid, architecture and data centers and IT staff that have to manage more than they can handle, right? Not all of these deliver those single pane of glasses or those operational efficiencies that you need. So we also still leverage many tools, many security, many IT products that you'll find in your data centers today that those vendors have now expanded to the cloud, allow us to look across, configure, manage holistically, whether it's sitting in Amazon, whether it's sitting in Danville or wherever. So the story with this is, our architecture and our service usage is just like our IT infrastructure. It's a hybrid approach, right? We use as many cloud-native services as possible, but we sprinkle in other ones as well to fill in gaps or make the operational aspects of it easier for our organization. One of the other big things here, when we talk about network and content delivery, so, we're in, north central Pennsylvania. There's only so many paths from where we are for redundancy. So one of the biggest design and discussions that we had besides what does the entire cloud architecture look like is what's our connectivity going to be, right? And, we've taken an approach where, co-locations are part of that. Different type of network technologies. We didn't just do one type of technology, one path. We've got multi-path to different places in the US, all that wonderful stuff. And at the end of the day, it leverages Amazon services and third-party services to bring that together for an area where we have limited redundant paths based on where our business is located. So with all of this said, and everything that we've done so far, we thought we would share some lessons learned and some words of wisdom, some trial by fire kind of stuff, right? Things where you tried it, it failed, you go back, and just provide some information that may make your journey successful. And things that both of our organizations, hindsight 2020 would have been great for us to know ahead of time, but now we know, and we learned and adapt from there. So I'm going to take some of the op model stuff and some of the infrastructure, and then I'm going to hand it off to the Sahiti and Mike here. But from an operating model perspective, this it seems like it's common sense and all that stuff, but before you do the technology thing, you got to do the people thing, right? You've got to have the right people in the right roles with the right education. You have to work on culture, right? As Mike said, an executive can't just say, hey, we're going to go to cloud, everybody on board, right? So culture and the human aspect of this type of project probably was larger than we expected, right? But without addressing that and continually addressing that, and our organizations had collaboration sessions every week. We had leaders come together, open, honest discussions about what's working, what's not working, right? How do we fix it because we don't want to talk about this next week, that kind of thing, to really bring between Geisinger and Deloitte our teams together as though they're one organization, they're one team. So, having your implementation partner on the same page with you, working with them diligently, and focusing on that human piece is probably the most important part of the entire project, because the tech's going to work at the end of the day. We'll get there. We'll figure it out. But you got to have your people with you. From an infrastructure perspective, I think we've covered most of this so far. But at the end of the day, it's a lot of the same concepts, a lot of the same theories. It's having your folks be able to look at it differently, or change the infrastructure as a code versus point and click, and things like that. So some of that is you really need to take the time to understand what are the skills, what's the new infrastructure, right? What's it going to take, and then ultimately how do you design it out for redundancy and resiliency? And then the big thing is to not bring your traditional technical debt or any of those thoughts and things about a traditional data center and just assume you're going to take that to the cloud, right? Really use it as an opportunity to have like what if or how can, right? Versus, well, this is the way we do it in our data center and it has to work this way in the cloud. It's not true, right? Use the opportunity to redefine the way that you do IT, you manage infrastructure, and all that wonderful stuff.
Thank you. And I just want to reiterate what Dan left us off with, in that it's okay to sometimes just start brand new and really pick up things that might not have been ever done within the organization. It was a pretty hard journey, but just the fact, the testament to, the great work that entire Geisinger organization took on, and having that partnership to kind of build out this innovative way of working into the cloud environment has been a great, great journey. And for me, if I were to categorize, without having to drain the entire slide, 3 takeaways. That's it for me at the end of the day. I think having a strong why, both qualitative and quantitative. Why do you want to take this journey, and actually continually reminding yourself so that you're looking at, this is the North Star and this is why I'm doing this, for the entire organization to be aligned is super crucial. So having that business case done ahead of time from a quantitative perspective. Qualitative perspective, really truly understanding your vision of, what is it that, Geisinger as an organization wants to be into future is extremely crucial, and they've done it so beautifully and gave us the opportunity to partner with them the right way to be able to define that. Has been an incredible journey. So that's number 1. Number 2 is essentially a very interesting aspect of going through this journey is learn when to keep moving forward or keep marching forward. Essentially, there was a point when we realized, hey, we're not going to have the entire financials through going through these general ledgers or through going through these accounting units. We worked very closely with the CFO team. And, hey, how can we best come up with the answers? Just being open to finding alternative ways where there are gaps to keep marching forward is crucial to keep pace with time. Otherwise, we fall into this, analysis paralysis way of doing things, which might result in, just delayed timelines and really, being a perfectionist over making progress. So that would be number 2. And then last but not least, I think my most favorite one of them all is having that end-to-end conversation across the organization, really strong, crisp communication. And I think Dan had mentioned it, and I know Mike earlier as well, in that it's truly a transformation for the entire organization. It's not sitting in a silo. So truly thinking through what is the impact that's going to have on every single individual that's going to go through this journey, and involving them the right way at the right time will give you the opportunity to advance as efficiently as possible. Having that thought process put in ahead of time from a change management, organizational change perspective is extremely crucial. And through this journey, I think that's probably one of the best outcomes that we've seen where we came out successful on that end. That I'll hand it off to Mike.
Great. So today we talked about some of the big barriers to going to cloud, specifically around cost and alignment. And we also talked about how we can use some of the methodologies and the frameworks that we talked today to remove those barriers and help to cost effectively get to cloud and help transform your own healthcare organization. As I mentioned at the onset, the cure for cancer is out there. What we need to do is use these type of frameworks. We need to help organizations get to cloud, have to use the technology that is on AWS, and we can improve patient outcomes, and we can improve and transform healthcare. So hopefully, everything that we talked about today about migrating to cloud is a little less cloudy. So thank you very much, everyone.
Any questions?
I think we were going to open it up for questions.